Professor Sartorius has been an exceptional individual.
Norman is the best ambassador that psychiatry has ever had and will ever have.
It's very difficult to find people who don't love him, and it's very difficult to be any part of the world. When you say you do psychiatry, say, oh, you must know Norman. I sometimes said, no, Norman who? And then they look at you like you're completely bonkers, but we all know who Norman is.
He speaks 5 European languages fluently, and that's what he claims. Actually, I've actually attended him giving lectures in 2 other languages, which he claims not to be able to speak, so he's a multi-language man.
When he trained here in the UK in the 60s and the 70s, he was one of the key players to introduce assessments and was one of the authors for present state examination, which was the way you assessed patient's mental state. And that led on to the whole new classificatory system.
He, with key colleagues, was the person who actually got the World Health Organization to recognise that mental health and mental illness existed, that mental health mattered, that mental health was something that needed to be treated, and that treating mental health for citizens across the world could make a real difference to not only them, but to society as well.
In my view, the most important contribution he made was to produce the model for mental health care in low-income countries. And this was by adapting primary care services in low-income countries and introducing mental health training to the people who run services in villages all over the low-income world, which is, of course, most of the world.
His contribution both to the UK psychiatry and the world psychiatry has been truly amazing. It's a number of things that he has done, number of activities he's been involved in, number of people he has trained is truly astonishing.
He is brilliant to work with because he'll listen to all the views, and where there are differences of opinion, he just has this very gentle but at the same time firm way of bringing together consensus, making sensible suggestions and helping people to move forward with tasks that are often difficult.
Norman conducts meetings in a very different way, and he can just turn aside tension with a joke, and he has an inexhaustible supply of them.
I think what sums Norman up for me happened really very recently when a few months ago we had a major conference on the DSM, the Diagnostic and Statistical Manual for those who don't live on our planet. And at the end we had a debate, and this debate was open to the public, and this was at the Maudsley, and it was packed out with an awful lot of students, trainees, psychologists in training and so on, and we had to have an extra room set up for the overflow. So Norman then started speaking on one side of the motion. He was in favour of classification in psychiatry, and I was the chair, and I had to follow the kind of emails and Twitter feeds from these people who couldn't put their hands up to ask questions. And then one came up from a trainee clinical psychologist, and it suddenly said, gosh, Norman Sartorius is so cool. I wish they'd say that about me.
And I remember, having a conversation with an early career psychiatrist friend of mine, and we decided that our screensaver would be WWND, which is what would Norman do? So under any given circumstances, what would Norman do, and how we would use his skills and his experience.
I think he was the most dynamic, the most research-oriented, and the most innovative head of mental health the WHO has ever had.
Every single person on the planet seems to know him. He has extraordinary charisma. His ability to hold a room is remarkable. And of course he has an extremely powerful and brilliant wife.
She's been an incredible source of support. She is an Egyptologist, and her knowledge and the information that both of them share with younger colleagues is truly giving.
I think the concept of remembering a Norman are a bit counterintuitive, because Norman will go on and keep doing things, and I think we quizzically thought that if anybody in psychiatry should get the Nobel Prize, it should probably be Norman, because he stayed there over the years and he'd helped psychiatry to grow, he's helped it to be recognised, he's contributed to the science, and he contributes to future generations of psychiatrists that we want, that we'd be proud of.
I'm really delighted that Norman is being given this award, and it's recognition, one among many, that he has achieved. Coming from the Royal College of Psychiatrists, I'm sure it carries a different meaning for him and for the college.